We're going to be doing some rock tape for patellofemoral malalignment today. I like to do this tape when I send a patient home to do home exercise plan. So great for our COVID-19 times when we're limited in office practice. We can have the patients doing a little bit more at home with proper facilitation of the vastus medialis and good patellofemoral malalignment. So basically, if we look at the patella of the patient, our tape might be slightly applied differently depending on how that patella is sitting. So we're going to mobilize it medial and laterally to see how it's gliding and kind of imagine that shape, almost like that heart shape of the patella, and see which way it's tilted. So for this particular patient, she's tilted laterally and also rotated superiorly. So the patella is kind of sitting in this plane right here. So what I want to do, I want to make the correction of tilting that patella medially here and rotating it inferiorly on the medial side. So then when she contracts her quadriceps, she's going to then ride up and down in the trochlear groove more effectively without hitting the femoral condyles with the medial and lateral aspects of the patella. So just 2 strips, pretty easy. So again, for this particular patient, I like to take the first strip and bisect the patella into superior and inferior aspects. Take the top half of the patella, put my base down, and hold that steady as I then tilt the patella. I'm going to hold the base and just going to tilt the patella medially, and you'll want to kind of pull down on this side here. And after you get that dynamic completed, your last part of your strip is just laid down. If your patients are blistering, it's because you're pulling traction on that base. Okay. And then, of course, when we swipe down the tape, it's just activating the adhesive. And we want to make sure we do that adequately so the tape doesn't come off. For my second strip, I like to do a J strip, and that's just taking the rotational component. So again, first strip takes the medial lateral rotation, and the second strip is going to take kind of the clockwise, counterclockwise rotation out. So it's kind of like, I call it my J strip. And put your base down, and then open up this rock tape. And I like to use rock tape. It has a good adhesive to it, but any tape that you're comfortable with. Again, you're going to come around that superior medial pole of the patella, and you're going to try to think about tractioning it down, back into a nice straight plane, and then lay your last strip down. Again, no tension on this last strip so it doesn't cause a blister. And when you're completed, your patella, the patella should look and track more medial and laterally. The patient will notice immediate pain relief when they leave the office and feel pretty good with this tape on.